Well, the emergency room at Methodist is one of two level 1 trauma centers here in the state of Indiana. So as you can imagine, the staff there is super busy right now. I just recently talked with a doctor there who says he's really optimistic because of the successes that he's seeing in the patients as they recover from COVID-19. And he also believes that they were able to make adjustments here because they got the early warning from Seattle and from New York, and that's leading to better outcomes here. And also he talked about whether or not he believes that this plasma that is donated from recovered patients really is the silver bullet that we're all looking for right now. Dr. Ellen, thanks so much for joining us today. You're getting ready to start yet another 7-day shift, taking care of the sickest of the sick at Methodist Hospital. And you're starting this week buoyed by success stories that you've had so far.
Well, we locally have seen quite a difference in sort of patient outcomes compared to what we've heard from Italy and folks from New York. We have been able to take a number of patients, almost now over 100 patients plus, through the ICU experience. Many of them have been intubated, meaning they've been on a ventilator or a breathing machine to support them through their illness, and have successfully gotten them off the ventilator to return to a life at home. So many of them are being discharged and back into society, and we've seen very few deaths compared to. So our death numbers seem to be relatively small, and what I would say is probably the deaths we've seen are very expected. These are people that had chronic illness, a lot of frailty. So unfortunately, COVID in that combination ends in poor outcome.
What do you attribute that to?
I think a lot of it has been learning, honestly. Sadly, New York kind of came first. Both Seattle and New York had that first wave, and we quickly realized that with what they were seeing, we had to be prepared. We had to be much more visual about getting our processes accurate and right. So they gave us a 1 to 2 week starting point to be able to change. And so we quickly changed just about everything, really, from the way patients come through our emergency departments and how we would cater to one patient population versus another, and making sure we're sorting them through and taking those COVID positive or suspected patients away from our vulnerable and frail population as well.
Talking about the danger, where are we now in your assessment relative to the surge, and how's morale?
I think morale is very positive. I think looking at trends and looking at the Indiana health data, it looks like we're probably at sort of a leveling. We hope not to see much more in the way of surge, and hopefully some drop off in the number of cases tallied over the next few days to weeks.
Do you see that release over the weekend about people that have recovered, that, you know, there's this interest in perhaps them donating plasma, that maybe they have antibodies that could help? As a clinician, when you see something like that, how does that resonate with you?
Yeah, I think it's an interesting tact. It'll be something that we'll have to further explore. Obviously, it's not a panacea. So just having the antibodies themselves, you have to match it to a person. So it's like getting an organ transplant. You can't just give it randomly. You have to have sort of a stable match to make it really appropriate. And you got to imagine, though, and that's going to be tasky in itself. And then you have to have enough plasma, right? You have to have a lot of different donors. So while it may seem like, you know, a silver bullet sort of thing, that's not necessarily going to be applicable for all. So the best strategy for now is still doing what we're doing, really isolating, letting the disease sort of quell itself, and hopefully figure out a strategy to let people re-enter the workplace and society. A lot of that's going to depend on testing and getting better testing of serum and antigens and antibodies. Once we have a better stand on that, then we'll know who's probably vulnerable versus who is easily able to get back into the world as we see it.
Yeah, let's certainly hope not. Dr. Ellender, we'll leave it there. Thank you so much for your time.